Hi, my name is Christine Kayas, and I'm going to be presenting bacterial meningitis after intrapartum spinal anesthesia. First of all, what is meningitis? In medical terminology, meninges are layers of the skin that envelope around the brain and spinal cord. Itis is inflammation, so therefore, meningitis is inflammation of the brain and spinal cord. What is bacterial meningitis? Bacterial meningitis is meningitis that is caused by a bacterial infection. This bacterial infection can lie within your nose, eyes, ears, complications from surgery, and in this case, bacterial meningitis is caused from intrapartum spinal anesthesia or the syringe that caused it. There are 2 cases, 5 cases, 3 in New York and 2 in Ohio. In the New York case, there are 3 patients. I will refer to them as patient A, B, and C. Patient A was a healthy woman, 24 years old. She received combined spinal epidural anesthesia from anesthesiologist A. She delivered a healthy baby, but approximately 22 hours after receiving the anesthesia, she experienced headache, back pain, rigors, nausea, vomiting, and disorientation. Patient B was a healthy woman, also, aged 31 years old. She also received the spinal epidural anesthesia. She also delivered a healthy baby, but approximately 21 hours after receiving this anesthesia, she experienced headache, back and neck pain, and nausea. Patient C, also a healthy woman, aged 37 years old, also delivered a healthy baby and received the same epidural anesthesia like the other 2 patients did. She experienced symptoms such as headache, lethargy, confusion, and a possible seizure 19 hours after receiving this anesthesia. Within this meningitis, there was one microbe that was found called S. salivarius, or Staphylococcus salivarius. This was cultured from their cerebrospinal fluid, and cerebrospinal fluid is fluid that surrounds your spinal cord and helps detoxify waste nutrients from your central nervous system. In the 2 Ohio cases, I will refer to these 2 patients as patient D and patient E. Patient D was a healthy woman, aged 26 years old, also received the spinal epidural anesthesia. She also delivered a healthy baby. After 15 hours of receiving this anesthesia, symptoms occurred including fever, nausea, and severe headache. A blood culture was tested from her to test because they kind of knew it was meningitis. So they did a diagnostic lumbar puncture, which is basically a needle that is inserted into the lumbar part of your spine, which is the bottom of your spine where epidurals are inserted. They collected spinal fluid testing for meningitis, and it came back positive. After 6 hours of her symptom onset, the patient became lethargic and unresponsive, but she recovered. Patient E was also a healthy woman, aged 30 years old. She also received the spinal epidural anesthesia and delivered a healthy baby, but within 13 hours, symptoms started to occur that included severe headache, fever, confusion, lethargy, and then she became unresponsive. After 7 hours of her symptom onset, she ended up dying, and her autopsy revealed that she died from meningitis caused by this S. salivarius. From the results of these 5 cases that occurred in these 2 hospitals, the hospital staff and HICPAC, which is the Healthcare Infection Control Practices Advisory Committee, they performed an examination of these hospitals and collected cultures. They collected the anesthesia bags which were used to inject these patients, and they also collected sort of like samples from the 2 anesthesiologists that injected these patients in both hospitals. From anesthesiologist A, which was the New York anesthesiologist, they collected a nasopharyngeal swab, which is a swab that is inserted into your nose to collect some mucous membranes from there. And they also did a test on anesthesiologist B from the Ohio hospital, and they collected a mouth swab from her, and they both tested positive for S. salivarius. The cause of this was because they did not wear masks before performing these spinal epidural anesthesia. Supposedly, their procedures were unclean, so HICPAC came in to the hospital, according to the editor, and recommended safe injection practices, consistent use of aseptic technique using loose needles and sterile needles and syringes, and healthcare providers should be familiar with safe injection practices. HICPAC made all these recommendations that surgical masks should be used by healthcare providers and hospitals who are either placing a catheter or injecting material into a spinal cord or epidural space. HICPAC is just there to recommend safe injection practices, safe practices, hygiene practices for hospitals and healthcare providers, and that is my conclusion of these cases.